All right, good afternoon, everyone. My name is Lisa Sipenko, and I head Consilium Scientific. Today, we're very pleased to welcome Nicholas DeVito, who is working at the University of Oxford at the Nuffield Department of Primary Care Health Sciences. And Nick is here. Nick is doing a lot of stuff, and I met Nick first when he was the czar of the trial trackers, and I think he still is. So very important work on trial transparency. Um, but today Nick is here to talk about the European project. He's part of the OSIRIS project looking at the reproducibility in science. So Nick, the floor is yours. Please go ahead.
Great. Everyone can hear me all right? All good?
Yep.
Yeah, great. All right. Thank you so much, Lisa. Thank you for having me. Very happy. I've spoken to Consilium once before. I think it was about COVID clinical trial reporting. And now, a few years later, I'm back about this new project. So, yes, as Lisa mentioned, this is part of the OSIRIS, and as part of being a European funded project, we need to put these disclaimers like this up that say, our views are not representative of anyone in the EU, even though we're funded by them. So don't blame them for anything that I say that makes you angry. Um, so just a little tiny bit about me beyond what Lisa said. So I'm a postdoc and the research integrity lead at the Bennett Institute for Applied Data Science in the Nuffield Department of Primary Care at University of Oxford. That's also where I did my PhD. And yes, as Lisa said, I'm the co-creator and maintainer of the Trials Tracker project and a member of the OSIRIS Consortium. That's the very brief bio of where things currently stand for me. So this is OSIRIS. This is our website. We are a consortia of nine universities and organizations in the EU plus the UK. And our acronym stands for Open Science to Increase Reproducibility in Science. And basically, this project came out of a Horizon Wadera call called Increasing the Reproducibility of Scientific Results with the following aims. So determine how increased reproducibility generates gains and savings in the RNI process and improve overall performance alongside the demonstrative positive effects on their quality, integrity, and trustworthiness, and find, experiment, and mainstream concrete solutions and best practices to increase reproducibility of research funded with European taxpayers' money, so on and so forth. So those were sort of the main drivers of what we were trying to do. This call had three projects funded. So in addition to OSIRIS, there was Tier 2 and iRise. I've put their websites there. They are both really excellent projects. I can't speak highly enough of my colleagues in both of them. And it's been a really rewarding experience because sort of we've had the ability to work really closely with our sister projects. We have our like joint consortia meeting. We've collaborated. I'm going to talk about a scoping review for a little bit, which was done in direct collaboration with Tier 2. We're making sure that, we're not doing things like all contacting the same stakeholders for all of our projects to annoy them. So that's been really, really rewarding. And new collaborations are forming between the groups out of this for future projects. So that's really exciting. Um, so since we're talking about reproducibility, I think it's useful to think about what reproducibility means because for people in this space, that's always a bit of a sticking point. Um, some of you might be familiar with this piece by Goodman, Finelli, and Ioannidis, where they talk a lot about different types of reproducibility and the different forms of reproducibility can take. And I believe they talk about results reproducibility, methods, reproducibility, and inferential reproducibility as the three main kinds. And this was highly influential with how we thought about these concepts. But because this is an EU funded project and because it's was being slightly more pragmatic from our positivist angle, we sort of used the definition from this EU report. So that is kind of inclusive of a bunch of different ways one could interpret reducibility. So it's viewing it more as a continuum where you have reproduction. So that's where you're actually taking the original materials and redoing the analysis. So that would include like direct, like a computational reproducibility. Replication, so using the same analytical method but different data sets or populations, and then reuse, which is where you can take a result and not necessarily the aim is to replicate or reproduce it, but you sort of need to do that in order to then build on it. So you can think of the continuum that exists there on a very so when you wouldn't believe when you get a bunch of people who care about this stuff in a room how much you need to go about defining your terms. So I just wanted to define terms a little bit here for us in this chat, for what we like to think about when we're talking about reproducibility in this project. However, there is a bit of a constructivist element as well to this. So one of the big projects we're working on, and this is led by my PhD student who I co-supervise in Belgium and at KU Leuven, Magdalena Kozula. And I'm going to be grazing over a lot here, but we did over 60 interviews with European scientists with like sort of a recruitment strategy that emphasized diversity in geography around Europe, institution size, gender, career stage, and discipline. And as you can see, we managed to get pretty even representation through all of those areas, which is took a lot of work. And I don't know how much experience everyone here has it with qualitative research, but 60 interviews is a huge wealth of information on these topics. And this is still actively sort of being analyzed, and we're writing up the first paper on this now, and hopefully lots more will follow. But these were sort of the four areas that we've broken down into like where our coding goes, and it's thinking about perceiving and understanding reproducibility, the actual research practices that people do that support reproducibility, and then barriers and facilitators. And just thinking around those first two, we've focused mainly on the second two, the barriers facilitators first. Our first paper is going to be about that. I'm going to talk about that a little bit later. But there's some interesting findings that come out when you talk to a really, really like domain diverse group of people about reproducibility. And it's, as you might imagine, we did not pluck anyone into our sample solely due to their prior engagement with reproducibility. So we're dealing with a very potentially reproducibility naive population. We weren't just picking people from UK reproducibility networks. We were literally, for most of the sample, going in and taking like what was the most recent paper published from this institution that's included in our sampling method and pulling an author out and inviting them to participate. So really a broad swath, people in the natural sciences, as you can see there, people in the natural sciences, medical sciences, social sciences, humanities, agricultural sciences, and engineering technology. And what reproducibility means in each of those places varies greatly. Not much experience in our sample with sort of direct replication. Like I've done a replication study, like gone and taken this and published a direct replication of results, but it's sort of inherent in a lot of areas. So especially sort of in the engineering and physics space, oftentimes like one interesting interview that we did was with physicists, and they were part of some big physicist consortia. And basically they spent a whole year making sure that everyone in the consortia could reproduce the same result on their local instrumentation so that then they could feel comfortable moving forward, doing their different experimentation in whatever parts they are in charge of at their different centers throughout Europe. And that's really interesting to me because when we usually think about replications and reproducibility, we think about it in a external facing way. So like I want to allow this person when the project is over to reproduce my results, or I'm going to take your study that you did and replicate it myself and then publish that replication. But it's really interesting to hear that sometimes that's in the beginning of the study, right? Where we're going to do internal, and then you also hear things about like internal labs, people having trouble even replicating things within their own labs because of poor documentation and so on and so forth. One other finding from here, sort of preliminary finding I wanted to point out is, everyone, like I said, you think a lot about things like computational reproducibility or replication, doing the same study again, running the same code on the same data, getting the same results. I think that's what people classically think about. And when you talk to people who aren't sort of engrossed in this world and thinking along those lines all the time, a lot of times they're thinking about way more of what in the Goodman sense is referred to as inferential reproducibility. And it's that, can I look at the same results? Can I read your paper, follow your logic, and come to the same conclusions? Or can I at least see how you got to your conclusions and think that that's supportive? And that becomes way more important in the day to day of how I think people conceive reproducibility and what that means in the actual like day-to-day conduct of science. Because replication studies are relatively rare, especially outside of like social science and psychology fields. They're impossible in some instances, like very, very expansive, large clinical trials. You wouldn't necessarily expect independent replication to be a priority there because of the cost involved and things like that, and the difficulty in design and recruitment. That's why meta-analysis is so important in the medical world, because you need to be taking these diverse, expensive, hard to conduct trials and getting something, some big point estimate out of it. But anyway, those are just some interesting things about, how reproducibility is conceived. Even reproducibility, the concept sort of in the humanities, is a topic that gets talked about some, and that inferential reproducibility of being able to sort of follow logic and follow argumentation really is key to it there. So where do we stand in Europe? That was one of the questions we asked, and this is actually the project I led as a part of the consortia. And this just wrapped up, and it's still being tweaked a bit, but I can give a quick overview. So TOP 2025, if someone's familiar with TOP, it's the Transparency and Openness Promotion Guidelines. They were originally released in 2015. They are led by the Center for Open Science in the US. And basically, what they were originally designed as was a bunch of criteria that journals could implement. It was envisioned to basically journals can implement them into their policies and to promote transparency and openness and hopefully impact things like rigor and quality and reproducibility. They were updated just last year. Well, the draft was the proposed preprint came out at the end of last year, and then I think in February the final preprint came out. I assume that will be published somewhere soon. But basically they were updated to be slightly more coherent, slightly more broad, and potentially applicable to stakeholders beyond just journals. If you're interested in top, you can go to topfactor.org. That's where like over 3,000 journals were assessed for like their top score on the top 2015 criteria, but now that's now being superseded by these 2025 criteria. So what we did is we're like, oh, this is great. Why don't we try to take TOP and apply it to some other institutions and kind of see what the European landscape looks like? So we did 3. We call them audits, but not necessarily all these organizations committed to following TOP. So it's not really an audit and feedback as much as it's more of a landscaping exercise. But audit is just sort of a bit of convenient shorthand. So we took the top 20 journals by the number of peer-reviewed Horizon 2020 outputs. The largest public research funder in each EU country, plus the UK, plus the Horizon program itself, and the top 20 higher education institutions in the EU and the UK by number of H2020 grants included, with a max of 2 per country to ensure geographic diversity. And these are the top criteria. So basically you're broken down to 3 areas. You have research practices, which are graded on a 3-point scale. So basically level 1 is for any of these areas, do you require someone to say whether they did it or not? Level 2 is you require them basically to do the thing and disclose it. And then level 3 is somebody independently verifies, an editor, a peer reviewer, someone is basically required to independently verify that you did these things. Verification practices are like results transparency, which is basically making sure that you did what you said you were going to do, that someone independently verifies that. And computational reproducibility is, of course, that your code is shared and runs and on the data and can produce the same results for an independent party. And then basically the last one is verification studies, which is a little bit more difficult to apply to other institutions, but basically, as it was visioned for journals, it's do you publish on offer like to publish these kinds of analyses, whether they're basic, you do allow replications, register reports, and then the slightly more esoteric multiverse analyses and many analyst studies. We also checked whether people endorsed, the institutions we looked at endorsed DORA or COARA, which are research assessment reform organizations, because we were interested in sort of how that lines up with practice in embracing some of these areas. And so this is basically this is where journals lined up, and you can see that data sharing is by far the most common thing people are asked to do. Registration, protocols, materials code, everyone's doing something to some regard, but not all of these. There's a bit of nuance contained within this bar chart because, first of all, almost nobody is at level 3 for anything. It's extremely rare to require independent verification that you've done something in order to like be published somewhere or as an editorial policy. Secondly, for things like reporting, sometimes it's only certain types of studies need to, oh, if you're they specifically might say, like, if you're a clinical trial, you need to use consort. If you're an animal study, you need to use the ARRIVE guideline. But it's not sort of a universal thing, saying you have to use an appropriate reporting guideline if one exists in your area. And then lastly, especially I assume some of the people on this call might expect, there's what I like to call a bit of clinical trial exceptionalism. So if we look at this, this is basically if there's any requirement for you to do a thing, you got credit for it here. If we take out requirements that only apply to clinical trials, the bar chart changes quite a bit. Basically, you get people just offering so clinical trials, you have to register. We're following ICMJE guidelines there. You have to register, but everyone else, you only sometimes need to. We think it's a good idea, but you don't have to. We're not requiring you. We're not making you register your trial. So like you can just see how the red jumps up from here on registration and protocol sharing to here. And analysis plan changes, so you can see what that looks like. For funders, there was extremely low engagement with anything other than data sharing, a little tiny bit of code sharing. And even that we had to sort of develop, which we're still refining a bit, but develop this sort of hierarchy of what they are actually doing. So do they require it from all funded projects? Do they require it from some funded project? Is it something that's not required but is evaluated? So for instance, they might say, you don't have to share your data, but we're going to score your grant application and you might get less of a score if you don't share your data, but it's not actually required. It's planned. A lot of people said we're going to do this or we're looking into doing this. It's supported. They say we think it's a good idea, but we don't make you do it, or it's even just mentioned as a thing that exists. Like I said, we're still tweaking that a little bit, but you can see what that looks like. And then for academic institutions, for universities, essentially, you saw a lot of great support. You saw like research support policies, really like great policies on data management and internal resources to support people in sharing their data and making it available. But like, and this was part of adapting the top criteria to these other institutions. So for instance, it's not, an institution can only do so much for every researcher under its umbrella, right? They can't sort of require everyone to do something, but they can offer. So it's sort of like, the question we ask isn't quite, did you require this? It's, did you offer supportive, materials, or you could require it. That was a thing we assessed. But, the question looks a bit different for things that aren't journals. And another thing we asked of institutions were, do you reward these things specifically in tenure and promotion? And the answer to that was pretty universally no, other than the Belgians. The University of Ghent had some really good language in their research assessment criteria for internal folks on data sharing and open science. And KU Leuven has a whole like proposed framework that they're very publicizing, saying we're looking into this, we're working on it, where we would like to reward these things. So that's really interesting, very geographically concentrated in one country in Europe. Is this being considered as a tenure and promotion thing? Dora and Koara, which are those research assessment sort of reform organizations I mentioned, are they're actually quite popular. Many of the organizations in our sample looked at one or both, endorsed one or both of these. Journals can't endorse Koara, so that's why it's NA there, but because they're not directly involved in research assessment, but lots of them endorse Dora. So that's a little interesting, right? Practice is not matching up with sort of these stated commitments to quality research over quantity research and so on and so forth. And it could be interesting to explore how and why that is, and the things that are leading to that. And we're hoping that some of our other work sort of starts to answer that question more. What's the evidence for reproducibility? So I talked earlier about how we had a scoping review that we did. So we did a big systematic scoping review with our colleagues in Tier 2, which is one of the other reproducibility projects. And the headlines, there's a lot there. It's published on Royal Society Open Science. If you're interested, you can pull that up. But just to give big takeaways here, we found 105 studies that were sort of met our inclusion criteria. But most importantly, only 15 of them directly look at whether an intervention increases reproducibility. So like reproducibility was the outcome, or replicability as a related or sub concept of reproducibility. The rest were sort of one step removed, and we called these proxy outcomes. So you could imagine something like open sciences practices that are like all those things from top, basically, I said registration, things like that are all sort of criteria that we think, and then so people think that they're researching reproducibility, but they're reproducing a step on the path towards reproducibility. Some of that is self-inherent in a way, right? Like if I don't have code and data, and I inherently cannot do computational reproducibility on your project. But I think a big takeaway from this was that, and I'll hammer this home a bit more in a bit, but a big takeaway here was basically what, like, that not only is we don't know what works to enhance reproducibility, we like the evidence level of evidence is very low. We also need to be establishing the links between all these things that we say enhances reproducibility and reproducibility itself, because the evidence base on that is very like you can say, oh, doing this makes people share their data, but does that actually translate into increased reproducibility down the line, or are there other barriers in place? It's sort of like surrogate endpoints in clinical trials, right? Does this thing actually get us to where we want to be? And then these are just evidence maps. There's a lot of detail I'm glossing over here, but the most important thing to note, just to hammer home the point I made, is all the empty boxes, which basically show that there were not studies in these intersections of sort of outcome areas and classes of like interventions, and then like just a continuation of that same thing. Lots of empty boxes showing lots of gaps in the evidence where things we take for granted that they might be good for reproducibility don't actually have a lot of evidence backing up that claim. So this is just basically a paragraph from the conclusion of this study. So, despite everyone talking about how important this is, there are very small amounts of evidence directly for what enhances actually the reproducibility or the replicability. Lots of things saying and looking at how irreproducible evidence is, or the extent of practices that we think promote them, but very little making that connection. And the ones we do have are of particularly poor quality and variable design. You're just not seeing, for instance, RCTs in this space very often. So one of the things OSIRIS is doing, and what we're in the midst of now, this is a 4-year project, we're in the middle of year 3 right now, is actually fielding some interventions in this space. So we have an intervention running right now at journals. So basically does providing feedback about adherence to open science practice, improve reproducibility. So it's a peer review intervention at a journal where, like, can we look at your manuscript, can we assess it for computational reproducibility, reproduce it, and if not, can we give feedback that might make it more likely and better to do that? We're doing a funder thing as well, where we're looking at a bunch of accepted grant applications, and we're having people independently score them, and some people will use a checklist and some people won't. And we're trying to see if that checklist, if essentially evaluating the grant application while you have the checklist, does it make you better than chance able to predict whether the quantitative outcomes of that research are reproducible in a computational sense. And then lastly, we did this big Delphi process to create an open science checklist, which is related to, but not exactly the one we used in the funder study because of timelines and things like that. But we basically are planning a study with preprints where can we like assess preprints with the checklist and improve their eventual reproducibility during publication. That some of my colleagues are in the process of planning. So the funder and journal ones are fielded now. We're in the process of data collection, and that last one is being planned. And if anyone is there's this reproducible research in action project that's going on, this conference that's going on in Berlin in the autumn. I think it's in October. I put the website there, and this is actually one of the accepted projects for that conference. And you can go to that conference and you can help. There's like 8 or 9 projects or something like that, and you can pick one, and essentially you get to help them develop and take their project to the next step. And that project was chosen. So my colleagues Constant and Rita will be there, and they will be working with people to talk about how to take this checklist they developed and bring it into action. And this is just that checklist, just so you can see there, it's a boring slide, lots of text, but these are the types of things that were assessed in the Delphi that were proposed sort of in the Delphi process and went through question screening and then a consensus process, and then those lined up and met consensus here. So can I see? Yeah, there we go. So you can see blue means no consensus, green means it reached, blue means it was consensusly rejected, yellow means it couldn't reach any consensus and was therefore rejected, and green means it made the checklist. So coming back a bit, this is my last couple of slides here. And this is good, wrapping up right on time around 5:30. So back to our qualitative work that we're doing, that my PhD student is leading. And thinking about these barriers and facilitators, we've been doing a lot of thinking lately about how what we learned from this project can translate into policy recommendations based on what we heard from a broad array of researchers. Like I said, 60 interviews with people across career stages, disciplines, so on and so forth. And these were the main takeaways that we've sort of, our working list of main takeaways that we're going to be developing further. But I don't think anything here is something that hasn't been said before, but we're hoping that we're sort of putting more evidence and demand behind some of these and a bit more strength, and feeding them back to the EU, who had sort of commissioned all this work as maybe a major actor that can take action in these areas. So basically reforming incentive structures, that's that DORA and those COARA commitments, align evaluation criteria with open and reproducible practices, which, as we showed, is generally not happening. Moving beyond quality metrics, improving publishing ecosystems to strengthen journal requirements for the top players in the field, promote publication of null and negative results, and address transparency, harm rule, peer review feedback, which is something we heard about, where people would say they tried to do the right thing and then the right thing got nixed in peer review or got pushed back in peer review in certain instances of where you're trying to do something and show extra and say that's too much detail, don't put it in the paper, blah 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 blah, things like that. Equip researchers to do reproducible work, invest in training, invest in user-friendly and field-sensitive. That field-sensitive infrastructure is very important, and support realistic timeline and resourcing. I think personal opinion here is, and I think this is being backed up by our data analysis here, is that a lot of the reproducibility crisis, which is a term I don't like and has fallen out of fashion, but a lot of the reproducibility crisis has focused a lot on psychology and social sciences, and it's had a lot of uptake and a lot of thought, and a lot of the leaders in the area are from that area. But that might not be or mean the same to someone in a natural science or a physical science, and what they need or need to do or need to be provided with in order to make their work reproducible. Some things have broad sort of remit, like pre-registration as a way to project against p-hacking or hacking or things like that, or fiddling with experimental procedures. but outcome switching, all of those things, that sort of is field agnostic to a sense. But how and what that means and how that needs, and more importantly, how to do it in a field, templates, things like that, right? That just don't exist for some places. And I don't think we can expect uptake in those fields without more attention being turned to it there. And support realistic timeline and resourcing. And then close policy and epistemic gaps. So make funder and institutional policies not symbolic checkbox institutes for people here in the clinical trial world. I'm sure you know all about how things like registration has become in many ways a tick box exercise. I have a whole talk I could give about that topic. That I've given a few times before. And once again, developing those field specific standards. That's so important. And I think really is like the future, like that's the horizon, is like taking what we think works, adapting them to all these individual fields and testing, and developing real evidence about what works and what doesn't to improve what we'd like to see, which is a more rigorous and more transparent science. So thank you. That's my email. I'll just leave that up for 2 seconds and then I will close it per Lisa's explicit instructions. But of course, you can email me with any questions about any of this work, about OSIRIS. My email's not hidden. If you don't get it now, you can find it, but that's it. So let me end and stop sharing. And there we go.
Thank you so much, Nick. Great talk, and I appreciate if some of you who want to ask questions, please turn on your cameras, raise your hands. And while you're thinking about your questions, Nick, I have two difficult ones. So, question number one, perhaps in OSIRIS, you've already thought about this, but so the first question would be about for example, if there is a very clear commercial incentive, and we have plenty of examples where a pharma company would want to go and recheck academic experiments, and then for their own purposes, they might not actually release that information. I think Ioannidis wrote about this when Amgen did replication studies, and we actually never learned what was behind them. So the point of replication to serve humanity, I guess it needs to be public. So, and so I guess my first question is, how do you, who's going to fund it? I know you're touching on the idea of funding, but for example, you at your department, can you potentially get funding to say, that was such an interesting study, let me reproduce it? Like, is this even possible? Is the system designed this way? Because the whole system was built, no matter what, natural sciences or social sciences, it's go get a Nobel Prize, go put us on the map, go publish in the top journal. You're not going to publish in it, like doing a reproducibility study could be of great curiosity, especially if you have a next step in mind. But there is no funding system around it. And obviously, it's not driven by relevant incentives. And some people, I can imagine, can be very resisting to it, because we had that with Alzheimer's, where a particular thought has been, I'm not saying it wasn't replicated, but it really, really drove the system in a wrong direction for years. And people made a lot of money on that. So what are your thoughts about that?
Yeah. So the commercial end of it, that's a tough nut to crack. Most of what I'm working on now and what we work on is very much focused towards public sector, financing and thinking about this and how we can improve like the European R&I system. And while like it would be great, I think there are, unless it's clinical trials, there's less levers you can pull forcing companies to release this kind of stuff. So that might be just a barrier, like an inherent barrier. But you'd hope if a finding was important and broad enough that there might be some interest in replicating it even outside of industry. But to your second point, which is a great point, right? This stuff isn't currently rewarded, and only certain journals will even consider pure replication studies to publish. And some of them even put like Nature, like you can get a replication in Nature, but there's a corollary that you need to it needs to offer something substantively new. So you can't just say, oh, we replicated, DeVito et al. And it worked. You can't, you'd have to sort of, and I think that's not necessary. So I think there needs to be a place for that to happen, because I think that's important that people are checking. But I think the answer to your question though might be more of thinking about how we can, if research is almost always building on other research, it might be worthwhile to think about how we can build an inherent process into our research workflows in which reproducibility or replication, depending on what type of study you're doing and what field you're in, is sort of an inherent part of what you're doing, and is like a first step. So let's say, like, I'm probably closest in my training to an epidemiologist. And let's say I was doing an epidemiology study and I wanted to and I was basing it off of taking someone else's effect and transferring it to another population or building on it. Like, perhaps my first step should making sure that their thing actually, can I get the code? Can I get the data? Can I get the data set they used? Um, can I run that on that again? And can I see if I get the same result? Okay, great. Now I have confidence now to move forward and assess this again. And I think that's a step that's often left out, and it leads to a lot of research waste because we're building and doing research on potentially spurious, irreproducible findings. So, like, it might be, and I think that in some fields, so like in like bench science, if you're taking someone else's model and trying to work with it, you might not write it up as a replication study, but your first step is often you have to like do what they did and make sure it all works right. Because otherwise you can't build on it without making sure it works right on the bench, right? So, like, but that's not thought, that's just thought about as like a natural part of the process. It's not thought about as like and published on. You might never know that they did took that step, but it sort of naturally can happen. Or like I mentioned with the physics example, where they spent a whole year essentially calibrating things with an internal reproducibility exercise. That's probably never going to get written up, but it's going to make their results presumably a lot more consistent and rigorous. So some of it might be opening the door to incentivizing and rewarding and publishing direct replications, but some of it might also be people internalizing these things in where it's possible and where it's warranted into their own research pipelines and working with them in that way.
Do you think a system like, I mean, it might be a very crazy idea, but when the grant giving body is giving money to a particular institution, like you won the grant, a part of the grant becomes, you don't necessarily double it, but almost double it, saying, uh, we must replicate this work, and it's our choice to which institution we will send replication task. And your requirement in order to fulfill this grant is to enable all the relevant data transfer for that group to perform replication. And that group just, I guess, that gets lucky as part of the system because it was your idea, but they must perform replication, but they cannot be connected to you. So it's properly independent work.
That would be the dream. That would be a dream. That would be
All
great.
right,
So you
let's
could
write it down.
imagine you
Put it
could
as a mission of OSIRIS.
you can
Excellent.
imagine lots of ways in which that could happen, right? You could imagine like we funded a call and then we have the same exact call again with independent RFPs for people to bid on, doing a independent labs to bid on doing a replication on a finding. The Netherlands, the NWO, the Dutch Research Foundation, is they've done pure replication calls. So basically, the whole proposal was give us like an area of research you think it deserves replication, and we will just fund you to do pure replication. Exceedingly rare, exceedingly
Yeah,
rare.
I
But
can
you've
imagine.
also heard, I mean, I think there's been some things now where NIH is funding sort of internal replications as well, where there's been some call. I mean, I cannot speak to whether that survived the current admin's uh,
Yeah, and
things that are going on, but I
in the
remember
middle of a
seeing,
hurricane, so
yeah.
let's see when it comes down what stays
But
on
there
the.
was some news not too long ago about NIH putting out like internal bids for people independent groups to replicate internal findings. They
Thank
weren't
you.
going to make it public though, which is important, but yeah.
Yeah, I'll ask my other question after I give David a chance to ask his question. David, please go ahead.
Yes, I wonder what you thought of the Delphi process. I was recently involved with one which was meant to be designing subjects that ought to be on the pharmacology curriculum, and the results were pretty awful. I thought it was like a camel is a horse designed by the Delphi process. There was a duplication in the final result, and it was not impressive at all. So
Yeah, so my colleagues ran the Delphi, but I did have direct input in it because I helped run. I was the independent moderator of the consensus sessions. So yeah, Delphi processes are interesting. I think they work best when you have very like discrete things and everyone shares a specialty in that thing. I mean, I think the team did a pretty good job with what they were working with, but trying to get people from a bunch of extremely diverse fields together to agree on what goes in a broad-based open science checklist was a rough task, and some interesting conversations went around because you just have people coming at it with completely different frames and completely different concepts of what these things mean and having to sort of get everyone together. So like, for instance, you got one of the things that didn't reach consensus and wasn't included was pre-registration, which was quite surprising to the team. But it is just because like people were just like, oh, pre-registration is not sort of broadly cross-disciplinary enough, like valuable to be included, and like that is the perception that won the day in the consensus meetings, which I think everyone on the team, coming largely, I will say, the team is largely based on people who from a biomedical background, were quite surprised by that. So yeah, that's just one example.
Thanks.
yes, thank you.
Amanda.
Hi, Nick. I'm one of your colleagues at the university. I'm following on from that question about the Delphi process. Were there other consensus processes that you think that you could have used but didn't use? And if not, why not? And what's that cool software that generated your Delphi results?
Oh, that cool software is our PhD student from France,
Okay.
Constant Vinatier. I don't know exactly what he used to generate that. He's actually helping me make some really good looking graphics for the policy audit as well. I'll ask, I don't know what he's using. I don't know if he's just using R, if he's using something else. I don't know. Actually off the top of my head.
Okay. So had you not used Delphi, but you wanted to at least get some element of consensus, whatever that means, what might you have used instead?
Yeah, so I think for what they were doing, where you have a bunch of discrete elements and it lends itself really well to an online survey, Delphi was probably the best choice for them. I'm about to run a consensus process. I'm no expert. This is all sort of new to me, but I'm about to run a consensus process for not an OSIRIS project. I got a UKRI meta science grant. So I'm going to be running it on an open code thing I'm developing. And I'm not using a Delphi. I'm going to use, I think it's called normative group process, where you essentially get groups together. I'm going to use a modified version of this, but you get groups together and then you basically show them ask questions, get everyone to sort of get to a foster discussion, come to a consensus about the answer to that question, the question being something that is relevant to your thing, and then move on. And then then you move on. So everything becomes like a question that gets discussed by the group and brought forward.
Okay.
So that's like another type of consensus method you could do that I'm going to be experimenting with in the near future. I have an already developed thing, so I'm going to be showing. The way I'm going to run mine is I'm going to ask the question, foster the discussion, then take what the group came up with, compare it to what I already, and then show what I already had, and then we'll see how we can combine sort of what the consensus with what I already had to come up with something that we think works best for the tool I'm creating.
Thank you.
Thank you, Amanda, for the question. Nick, so my other question was, and sorry about my ignorance, so I can have enough imagination to see how a particular lab experiment would be replicated, especially if it's very well described in methods, and everything is clearly written in previous documentation. Let's imagine back to psychology or clinical trials or any, let's say, non-lab research or physics research requiring absolute precision of measurement of particular volumes, of particular use of technology. From my experience, when you look at a lot of studies, even if it's okay, You can compromise with yourself and say, okay, it's not too bad. It's acceptable. It's of acceptable quality. For example, if somebody asks me to replicate a particular study, there's this tension with saying, hold on, but we can make it better because this was wrong, this was wrong, this was not the right comparator. They cut the corner here, they didn't observe long enough, they didn't do that. And it's not necessarily about clinical trials, but it could be this type of softer science where a lot of compromises might have to be made because of for very legitimate reasons and sometimes for very non-legitimate reasons, but they did pass that clearance for publication and they might be actually celebrated. So what happens with the replication there? Because if you do an improved study, it's not a replication, it's an improved study. So how's the dialogue in that area evolving?
Yeah, so I think you can imagine, like when you're doing a replication, the very first question you need to ask is this study worth replicating? But I think the way that's handled in it, when possible, one way you can handle that is you can, for instance, if you do think there were deficiencies in the original study, you could run it. You could imagine sort of like something like a sensitivity analysis framework where you're like, I want to see if this effect is robust, that this thing primes in psychology, right? This thing primes this thing and leads you to make this decision on the question we asked you. I think they messed this thing up, but they're still showing a positive effect size. So let me do what they did exactly, run that, see if that at least replicates, and then fix it. And then that's where you're getting into not just replication, but like robustness of results, right? So like, can it survive a replication and can it survive like slight alterations in methodology? And like, is that important? And I think that's like a really important way to think about this because that's that like, reuse thing we were saying where like, because you're almost building on the results, you're saying like, is it robust to changing this thing that we thought might be important to the final result you got? And I think that's a big reason too why you see that decline effect where like the first statement of an effect size is usually the largest and every subsequent attempts to reproduce that effect size usually are smaller because it might also be to your point, Lisa, like you don't actually like you might have a discrete thing and you're like, oh, they messed up this. We don't think this is a good implementation of this. Or they may have said they did something like allocation concealment or blinding, but they did it crappy, but no one could pick up on it because it's not reported correctly or the materials weren't available. And then you did it better, and that made the difference, right? You can imagine a situation where like you changed something, but you didn't even know you changed it. You just did it in a more methodologically rigorous way than they did it, and then that declined the effect, even if an effect still existed. So, like, I think that's some ways you can think about doing these types of studies and thinking about how they look in practice when we do them.
Thank you, Nick. Lydia?
Hi, do you hear me, Lisa? I'm in the car.
Yes.
Yeah, we
Yeah,
hear you.
Okay, thank you. It's a very practical question about replication for clinical trials. Like, as a funder, we got 2 applications for the same call, and we decided that the clinical trial would take place on the 2 locations, being the Netherlands and Australia, following an exact same design. And so my question is, could that count for replication? The studies are still running, and the idea is to compile the data at the end. But since they are independent trials, 2 locations, how do you put that in one way or the other count as reproducibility?
So yes, I absolutely think it really doesn't matter. I think if they're running in parallel or running one after the other, I think that would be a form of reproducibility. But I also think that, this is probably a question for biostatisticians and things like, and people who know a lot more about the math of such things to me than I do. But I wonder, I wonder if there are and this is me shooting from the hip a little bit here, but I wonder if there are legitimate resource and robustness like I wonder if there are resource and robustness concerns around, like, is it better to make that two independent trials, or is it better to make it one big multi-center trial? Like, because like I don't know, like I'm curious now what the answer to that question is, because I don't know if I have a strong opinion on that, because I think that there's something like, it probably has to do a lot with how many people you think you need to recruit, and then therefore how expensive the trial is and what the effect size is. Because you could imagine a situation where it's better for both to be operating under the exact same protocol and just increasing the power of that one study and like the ability to detect an effect and making sure everything is consistent. But on the flip side, an independent replication, even if they're happening simultaneously, you could imagine where if they both find roughly the same thing, and you can be relatively confident they did something pretty similar to one another, that's really like a good evidence for robustness. And meta-analytically, they would probably have a once again, the biostatisticians among us can correct me here, but I think meta-analytically they would probably have the same, like I wonder, like they would have approximately the same effect on a meta-analysis, right? Because it's whether you have one big trial that's weighted with the combined sample size, or two smaller trials with that add up to that sample size. That how that affects the like robustness of meta-analytic questions. So yeah, I think there's a lot of variables to consider, and I would love to hear more about that and what comes of it. That's what funder are you from, if you don't mind me asking? Oh, oh,
I think Lydia was talking about the anti-cancer fund that she's heading, and they are the ones that
oh, cool.
study.
Very
So,
cool.
okay. So Nick, very interesting and difficult problem. So I wonder if anyone who want to do a study, or maybe such study is being modeling the current waste in science, because there were a few attempts to try to figure out how much is being wasted because of lack of replication, because of poor quality research, and versus establishment of replication centers, basically government-funded institutions, which would whose job would be just to do replication. So, for example, an IHR funds a particular study, and then it goes to a center where the work is replicated. So, like for quality control, and then the system can decide what goes forward, but it would be probably complicated.
Yeah, and I mean, you also have to think about, like, it's the same, like, if you're doing a huge phase 3 clinical trial with like thousands of patients and multiple centers, that's a multi-million-dollar affair, and like the cost benefit of actually replicating that needs to be taken. It's the same problem, right? Like if you're physicists at the Large Hadron Collider, there's only one Large Hadron Collider. Like, right, there's an instrumentation and access thing in some fields too about what people have access to, and in like engineer, like one of the people I interviewed was a PhD student. He was an engineer but working in a life sciences department on microscopy. He like was developing new microscopy techniques, and we had a great conversation. I really enjoyed that interview. Great conversation about how, like, things like the settings on the instrumentation are not something people think to share very often, but it's so important to what comes out of the final product and so important to reproducibility. And he said that's actually something he's been trying to do more in his work, is share as like supplemental material a lot more of like the technical specifications and how he set up the instrumentation. Like he didn't just point the thing and go, which is what a lot of studies would have you believe happens. But like, so yeah, like there's certainly a lot that needs to be considered in across this. And that was my plea for sort of disciplinary specific considerations for this kind of stuff and what it means. And yeah, so for instance, like I think for TOP, right, like those verification studies, like a many analyst study or a multiverse analysis might not make sense. It might be completely stupid to do in some fields, but there's other things that those fields can do to become more rigorous, and we should investigate what those are and how to facilitate them.
Okay. Thank you so much. Looks like there's still a lot of work to do. So good luck with the OSIRIS project and all the other work that you do, Nick. And thank you to everyone who joined today. This was our last event before the summer break, and we'll see you on the 18th of September when we're back for the new season.
Thank you all so much. Thank you for
Bye-bye.
listening and your questions.